Welcome to the OMG Podcast, brought to you by Onward Media Group. Join us as we explore storytelling with video, life as a startup, and community impact in Kitchener-Waterloo. We dive into industry trends, behind-the-scenes insights, and the challenges and successes of our journey. Whether you're a creative, entrepreneur, or just passionate about video and storytelling, we've got something for you. Now let's get into today's episode.
Hello and welcome to another episode of OMG, a podcast. I'm your host, Darren Bondy, and today I am joined by Jennifer Urosevic, President and CEO of Vision Loss Rehabilitation Canada. Thank you for joining us today, Jen.
Thanks for having me.
Thank you. For people that don't know, can you tell us a little bit about Vision Loss Rehabilitation Canada and what they do for Canadians?
Sure. Happy to do so. So Vision Loss Rehabilitation Canada is a national organization that provides rehabilitation and habilitation services to people who are blind, partially sighted, or have low vision. We are from coast to coast to coast. We have 44 offices, 300 dedicated staff who work with people on achieving their goals so that they can live the life that they choose.
I love it. I know when you and I first met, I wasn't sure what Vision Loss Rehabilitation Canada was. And just hearing the scope of what you do is kind of profound. And it's like one of these things where like people need to know about this service and about the fact that Canadians with sight loss have access to these things. And I think that was one of the things that stood out most to me. And also too, there is a little bit of that confusion between, okay, well, I know about CNIB or I've heard about CNIB. Yeah. How does this differ and how are they connected?
Yeah, I love telling our history. So for 100 years, we were CNIB. And in 2014, CNIB's board of directors and management team made a very ambitious strategic plan to ensure that rehabilitation was a right for Canadians who were losing their sight or who were blind. And they created a strategic plan called Path to Change, which fundamentally put the responsibility of this healthcare service into the hands of our provincial health authorities and advocated for adequate funding for rehabilitation. Through that journey, we learned that we needed to create a separate organization that could be fully dedicated and focused on this important need. And so in 2018, we opened our doors. We're still part of the client journey with CNIB. They provide incredible services that complement the rehabilitation journey for our clients.
It's one of those things where, again, as a Canadian, and obviously most of us or a lot of us are blessed not to have sight loss. You don't necessarily come across these services, but almost all of us probably know someone, especially if it's older members of your family that are starting to suffer sight loss. I do think the advocacy and understanding of these things is important because, again, this is a service that Canadians have access to. I know there's some big news recently with Bill C-284. I would love to hear a little bit about that. But before we get into that, I do want to talk. So today is May 1st. We're filming this. When it comes out, it'll be a little bit later. But it is one of those things where May is Vision Health Month. What's so special about this and what kind of stuff happens throughout this month?
Yeah, it's a month dedicated to vision health. And so how important to take care of your eyes when you have the ability to do that. There is still a lot of preventable blindness that comes through our doors, and if people take the time to go see their optometrist to follow up with eye care, we could prevent some of the blindness that happens in this country.
I love that. And so is there any special events or anything happening this month in support of that?
Lots of events are happening across the country, but a lot of it is around campaigning, which ties really nicely into Bill C-284 about preventing preventable blindness. Get out and see your optometrist. I'm going to see mine this afternoon for my biannual checkup.
I love that.
And I typically try and do that in the month of May every other year because glaucoma runs in my family. And so I want to make sure that if I am impacted by glaucoma, that we're catching it at an early stage where we can prevent things from happening that is going to affect my day-to-day life.
I'm also going for my eye checkup. It's my yearly annual checkup this month. I think I missed it in April, so now I'm going in May.
Excellent.
Speaking of Bill 284, with a new government formed, I know this is now going to be a big push to kind of support this bill. Can you tell us a little bit about it and how important it is?
Yeah, this bill really has been a passion of not only our organization, but the entire Vision Partners Association across Canada. So we work with the Canadian Ophthalmology Society, Optometry Society, Fighting Blindness Canada, Canadian Council for the Blind, CNIB, and many other organizations. And we've come together in support of this private members bill. The Honourable Judy Sgro championed this bill over the last number of years and got it through with the House of Commons and Royal Assent in October. Now Health Canada is working on how to implement this bill. And so now with a new formed government, we as Vision Partners want to be there every step of the way to help influence the dream of this bill becoming a reality.
Amazing. And what would change if it does pass and become a reality? How does it change and impact Canadians?
It has been passed, so we know this is law now. And so it's how the government now implements this. So this bill incorporates everything from research, prevention of preventable blindness, to good eye care and access to eye care no matter where you live in this country, to rehabilitation, through that whole continuum of care. So it's really important, and fundamentally it's going to change how our federal and provincial governments look at eye care.
And have you experienced pain points in trying to get the messaging out about this, try to get the support behind it? I know when we've spoken, it is a big topic that needs to be understood. Yeah. Where have been those pain points? Has it been difficult to communicate this concept?
Absolutely. You know, vision is one of those senses that people fear most of losing. However, sometimes we avoid the things that we fear the most. And so there will be, you know, things around campaigns around making sure that people are taking care of their eyes. And then also knowing what the access is. We know that 1.2 million Canadians are impacted by blindness and low vision. I only see, and over the last 5 years, 160,000. So there's an unmet need there. Now, if 1.2 million people came to me today, we'd have very long wait times.
Yeah.
That we need to make sure that people know about the services and that they come to the services that they need when they need them, and that they're referred. We receive an incredible amount of referrals from ophthalmology and optometry, but we also have a lot of people who self-refer when they're struggling with day-to-day living.
Mm-hmm. And in VLRC's role in this, are you kind of the champion, the advocate to push this through and get that kind of to spread the word across the country?
Absolutely. We're well positioned because we are in every province except for the province of Quebec, but we work really closely with the rehabilitation team in that province. And when we're closest to the clients who, you know, have lost their vision, I think that we're well positioned to help do some of that integration from the federal to the provincial.
And so as the journey continues with VLRC and your everyday work, what changes now with this new government? Is it going to be one of those things where it's an everyday effort across the country in your offices? Like what is happening on the ground every day to support this?
Yeah, so on the ground, our staff are still delivering the services that we need because we have a lot of clients who need our services. So that's their main focus right now. All of our executive directors are working with their provincial colleagues at the Ministries of Health. Federally, I'm spending time in Ottawa, where it makes sense for me to work with Health Canada on this as well to ensure that the work that we do is fully integrated into this bill. It can't be just about prevention. It's got to be about the whole continuum of care.
I love that. I want to switch topics a little bit, switch gears a little bit. It's kind of focus on a little bit of our relationship. And I know it's been over a year now since you and I first connected. When we first started talking, it was a lot to do with kind of getting the word out about what Vision Loss Rehabilitation Canada, what they are and what they do. I think that was a big piece of our initial conversations. But kind of what was the initial need for you? Say, I think I need video to support this. What was that the need there?
We wanted to be able to tell our story. And our story is about helping individual clients learn and achieve their goals. I said at the beginning, it's about living the life that they choose. So every client interaction is a little bit different. Some people want to learn how to travel to work. Some people want to learn how to prepare meals for their family. Reuse the remaining vision. So whatever somebody's goal is coming to us, we're there to help and support and develop the services around that. So when I really was looking at how do we tell this story so that everyone knows who we are. Being a fairly new organization with deep roots of history, we want people to know that we are a service provider that's there for them. And so our first relationship of talking about storytelling resonated with me because it is about telling our clients' stories.
Mm-hmm. And our first project together was kind of like that overview of the story and kind of the history, but also forward thinking and saying these are things that we provide for our clients and for Canadians that are suffering from sight loss, and it's a large number to your point. And so, do you see, it may be hard to see a tangible impact, but how have you felt the video has worked so far, the videos that we've done together so far in the impact to the community?
I think it's getting our message out. So, we use some of the smaller clips for some of our social media. We're getting more and more calls about, would this service help my family member? We also use it for the advocacy, going back to Bill C-284. I've shared the videos with them because it consistently tells our story of who we are and the impact. When you see somebody crossing a very busy intersection with a drone looking over top, it's like, wow, that's complicated. And that doesn't happen overnight. That's many lessons, many opportunities to learn those skills that enable somebody to live freely and travel where they want to go.
And I think for that particular clip, it visualizes a concept that may, most of us who cross the street, I mean, that intersection alone, even with sight, is a challenging intersection given the different turning lanes and the way people drive there. And so to see somebody navigate that with a dog and knowing that they have sight loss I was a kind of a surreal moment just seeing how busy the traffic was and being a little bit nervous too, to be honest, sitting there watching, being like, I hope like she can but again, the training and the hours and obviously too, the dog training as well and being able to use the guide dog, it was impressive. Another thing that's kind of stood out for us is it was always interesting creating video for an organization who has a large audience of people who cannot see the videos we're creating. So it's an interesting challenge. And we've obviously had to implement some additional layers when it comes to descriptive audio and different things like that to help kind of let all of the audience that can enjoy this content. Was there any particular moments that we've shared together? We've been on, I think, several shoots now together, whether they're at the office or on site with some different things. Has anything stood out about any of those moments with us so far?
I think for me, our relationship has been your openness to let's try it and let's learn together. Adding voiceover, making videos bilingual, were dreams of ours to make sure that they were fully accessible to people. And you guys have come up, asked good questions, problem solved with us. And I would say also our clients and our staff have been really, really impressed with the openness of learning about how we do storytelling and how to get the messages across that we want to get across as well. I know our clients get really excited because they don't always get the opportunities to see a behind-the-scene photo shoot or video. And so they're curious about those questions. And you've been really incredible about, hands-on and letting somebody who's blind explore what the equipment looks like.
Yeah, we definitely have had some fun shoots. I won't get into names, but one of the young boy that we worked with was that in and of itself was such a great shoot day just to be able to. I know he's a very curious boy and asked a lot of questions, but it was so interesting to be able to and it felt good to be able to share moments with him and let him listen to the drone or let him touch the camera equipment or understand where the lights are. And he kept asking us how bright the lights were, and it was really sweet. And to kind of give him an opportunity like that for us was phenomenal. I think it also tells a sweet story of a boy who actually does have real life challenges too, where he has to navigate his way to school and icy sidewalks and different things that can impede his progress is a reality that he faces that a lot of us don't. I mean, us, again, even people with sight can struggle with slippery sidewalks. Imagine not being able to see the ice, period, and not being able to navigate that. But we've definitely enjoyed working with everybody. It's been such a great experience and also a learning experience for us, people who are in the creative space and creating video, but then also understanding that some of the people we're working with aren't seeing the video. So we have to be a little bit more clear about how we're working with them, and even the work we did in the kitchen. Some of that stuff was just really, really enjoyable and a new experience for us. What's the feedback been like from the team? I know you said a little bit that they've enjoyed that learning process. I know we've gotten some feedback from some of the clients as well, but it's been pretty positive so far.
Absolutely. It's been very positive. When you guys joined us at our national board meeting and our service expo that showcased some of our community partners really appreciated the respect that they got from you on-site learning, and then also being able to be part of the editing about what are some of the appropriateness and the culturally safe things to include in the videos, and how we describe things. And so I think it's been, an incredible relationship. Some of the feedback that I get, and before we had our young guy do his video, he called me after the first one was published and said, "Can I please be in the next?" And I hear those messages as I travel across the country about how important storytelling is. And so I think there's some great opportunities for us into the future.
Which is actually where I want to go next. I'm very excited. We do have some projects coming up this year that we're starting to work on. And I do think there's so many stories that could be told. I even think of the iVan that we've talked about previously, but there are a lot of stories behind VLRC that people don't know about, even just at a high level. Give us some of the things that you think are important that might need to be kind of uncovered in the next couple years as we start to grow and create more content to support that.
Yeah, I think things like iVan, our eye health screening initiative, which is a mobile AI tool that is in remote rural communities to be able to not diagnose, but screen for diabetic retinopathy, and how important it is then that they get in to see a professional very quickly. I think that there's other really unique types of programs that we have around rapid response, so responses from hospital when there is a sudden and emergent need. Some of those programs, I think, are some of not our core work that we do, but some of these specialty programs that we have.
Amazing. Another question, just last question about us. Selfishly, I'll ask. If someone was thinking about working with Onward and through your experience, what would you say about working with us?
I would say that you're in really good hands. It is definitely a co-design, collaborative approach. If you want to use storytelling to tell your business story, to me, this is the best team to work with.
I appreciate that. We've really enjoyed working with you as well. Before we go, I do want to wrap with a little bit about what's next for VLRC in general in terms of, again, some of that advocacy. And I think the message for Canadians is, how do they get in touch in terms of whether it's like, is it referral forms online? Is it calling? Is it I have a family member or I myself am suffering? What is the best way to take that next step to be able to benefit from the services that VLRC provides?
Many ways. You can phone us. Or you can talk to your eye care professional to make a referral to us. We're there every step of the way. The other area that I'm really excited about, we launched last year our new strategic plan, Aim Higher, Reach Further. It is about putting clients first, broadening our reach to clients in rural and remote areas, and then creating an organizational sustainability. We have healthcare workers that are very specialized, and we need to build a workforce for the future. And so we're looking for a Canadian-made solution to educate people around some of these specialized skills. So I'm really excited about what that is going to look like, and would be happy to come back some other time and talk about some of the cool initiatives we're doing.
Amazing. Thank you very much for joining us today, and I'm sure we'll talk soon.
Sounds good.
Thanks.
Thanks for tuning in to the OMG Podcast. We hope you enjoyed today's episode and gained some valuable insights into storytelling with video, startup life, and our community impact in Kitchener-Waterloo. Don't forget to subscribe and follow us on social media to stay updated on future episodes. If you have any questions or topics you'd like us to cover, reach out to us at info@onwardmediagroup.com.